So both Dr. Endalman and I know that interprofessional teamwork and collaboration are important to patient safety and healthcare outcomes. And so part of what we use the Interprofessional Simulation Center for is preparing our students to work as a collaborative and cohesive healthcare team, because that's going to positively impact the care they provide to patients.
So what we have here is an otherwise healthy patient. I'm able to control his vital signs, all the specifics down to the blinking of his eyes. So what we're going to do is we're going to radio into the room, and I'm able to say, do you guys know when I'll be discharged today?
Well, as your social worker, I'm sort of working right now with both your family and sort of obviously like your nurses and your occupational therapist, just to figure out what the best solution would be for you, making sure that when you do get discharged, you're as comfortable and taken care of as possible.
And as your OT, we've been working on your strength and range of motion, your dressing, and your bathing, and you've reached all of our goals for the occupational therapy department. So as an OT department, we're ready to discharge you.
As your nurse, I have assessed you. You are looking great. We got the okay from the doctor. We are just going to get your list of meds, get your IV out, and then you'll be all set to be discharged.
Oh, I won't be going home with this IV then?
No, you will not be going home with the IV. We will take that out before you go home.
Thank you so much.
Of course.
Thank you.
And I'm able to hear the responses in real time. I'm able to, when my microphone is off, hear their discussions as they're talking about troubleshooting and making decisions on behalf of the patient and what's in their best interest. If I change any of the patient's status, I'm able to see them respond to those numbers in real time and record their responses. One thing that we're excited about is being able to allow the students to view their own recordings of how they responded in a situation and self-critique during the debriefing, because deep learning happens when we're introspective and when we're critiquing ourselves versus being told the things that we need to improve upon. So we're excited to be able to include the students in the growth of their learning.
So this is one of our high fidelity simulation suites. And so you see some students in action right now.
Well, I think with working with bodies, doing our nutrition-focused physical exams in a simulated setting will be very helpful for us, so much better than just reading it from a book. The interdisciplinary approach, being able to actually talk to OT, nursing, and students that represent the actual disciplines that we'll be working with would be very helpful.
Our opportunities here to be able to be preparing students in this safe learning environment so that when they get out in the clinical setting, they've had the opportunities to practice that communication, teamwork, collaboration here in a real safe learning environment.
I loved it. I thought it was really great new technology, and I loved to be able to be in a space that feels like the real world. Yeah, I think it'll make me feel more comfortable in the future when I'm preparing to be in the workplace.